Welcome to That's My Biz, the Internet Business Showcase, where we bring exposure to products, services, and special causes of local businesses and organizations. Thank you so much for joining us. We are coming to you live from the BizLinks TV studio. Brought to you by Southeast Computers, repairs, upgrades, custom builds, and restorations. SoutheastComputersATL.com. Hi everyone, I'm Pamela Alexander with That's My Biz, and we welcome you to another show where we love to bring to you the businesses and associations that we meet when we're out there networking. We want to remind you, make sure that you look for our episodes at www.bizlinks.tv. Also, be sure to subscribe to our YouTube channel at youtube.com/bizlinkstv. As always, I can always deliver on a great guest, and we have with us today Dr. Raushannah Johnson Verwayne, yes. And we like to call her Dr. RJ, so make it nice and easy for you. Now, she is a licensed clinical psychologist and the founder of Standard of Care Psychological Services. Dr. Johnson specializes in various types of specialized evaluations and the treatment of trauma throughout the lifespan. She is passionate about advocating for those who would otherwise be unable to advocate for themselves and prides herself on setting the standard higher. Welcome, Dr. RJ.
Hello.
Now, tell me, let's get right into it. Okay. Standard of Care Psychological Services. Now, what is that all about?
Okay, so Standard of Care Psychological Services, it's a private practice. It's an agency where families, children, other outside agencies can come and get high quality psychological services.
Okay. So now, why did you feel the need to start your practice?
So what I found, I was a clinical director of a couple of different agencies, and what I found is that with certain populations, particularly the Medicaid population, maybe lower socioeconomic status populations, they weren't receiving the services they deserved. Either they would be rushed in and rushed out, or a lot of the evaluations I read were cookie cutter. Every child was exactly the same. And I'm not sure if it was an insurance thing or what, but I said, this has to change. This doesn't make any sense. So that's why Standard of Care is here now.
Well, I love that. Someone that's giving back, but you saw what that need was in areas that needed some specialized or special attention that they weren't receiving. So now, tell us what areas you specialize in.
So I specialize in a few different areas that intertwine with each other. The overall area is trauma. So when we speak about trauma, it includes children, adults, and also specific parts of trauma, sexual trauma, physical abuse, neglect, being entered into foster care, also sex trafficking. So there are, I'm sure you've heard of Atlanta being one of the largest hubs of sex trafficking, but there are so many things that go into that to make children, teenagers vulnerable for those types of things. So trauma is the biggest specialty. Under that, if there is some sort of trauma, generally you'll see emotional and behavioral disorders. And so we do evaluations and assessments for children with severe emotional and behavioral disorders. So I'm not talking about just ADHD, but also things like bipolar disorder, some psychosis, children who are unable to stay in regular schools. There's a ton of things we do. We also do general therapy, so family therapy, adjustment issues, school issues. But the biggest thing that sets us apart from everybody else is the trauma aspect.
Okay. Now, and because these are definitely different times and trying times for when we were young, and children are dealing with so many different things. And one other area I think that's huge when you're talking about trauma, that people maybe they don't think about it as trauma, but something that we definitely see is even with the bullying and cyberbullying and how that's just rampant today as well. What are some of the signs that others can look at for children that are experiencing trauma, regardless of what it might be about or what caused it? But what are some of the signs that can help our audience with recognizing a child that might need to come to you?
So any drastic change in behavior is a sign of some sort of trauma. So a child who was originally outgoing may be withdrawn. A child who was generally an overachiever in school may begin to fail. A child who was well-behaved before and now they're acting out or lashing out or short-tempered, that's generally a sign that something has gone wrong.
Okay. So so you have some ideas of what to look like. So now when they do come to you, and you mentioned it's not just for children, but also you work with adults as well. So when they do come to you, what types of methods or treatment do you use?
So I use different treatments for children and adults, and every person who comes in, they get a diagnostic assessment from me to determine the course of treatment, because everybody is different. Even if one person has the exact same problems, their treatment will be different, and that's very important to me to have individualized treatment and evidence-based treatment. So I'll use either trauma-focused cognitive behavioral therapy, dialectical behavioral therapy skills, CBT, which is cognitive behavioral therapy, interpersonal therapy, family therapy, whatever works for that particular individual is what we use.
Okay, now explain some of those. So when you mentioned dialectical,
yes,
is that what you said? Okay, explain what that is.
That's one of my favorite, actually, DBT skills. So dialectical behavioral therapy teaches you how to use your wise mind. So this works for any of us, and even I use DBT skills in my everyday life. So let's say there's a situation that happens that is stressful. It brings about some sort of stress or hyperarousal. Your emotional mind may cause you to lash out or cry or, do something drastic. Your logical mind will make you ignore your feelings, and it may just have you sort of move on and stuff things in like nothing is going on. But your wise mind is the synthesis of the two. It's the one that combines both, and it allows you to make a good decision in that moment.
Yeah, that's really interesting. I'm gonna start using that so I can sound really super intelligent. My wise mind is telling me this. I love that. So you mentioned DBT, and then you mentioned some other types.
Yes, trauma-focused CBT. That's also an evidence-based treatment, but it's specific around childhood trauma. So there's a series of lessons you go through. It's a more psychoeducational type treatment, and there are certain steps you have to go through. It's almost like a workbook sort of thing, but you incorporate the family, you incorporate whoever else is involved, and that's how you individualize it. And cognitive behavioral therapy, that's very common and it's well known, but it teaches you how your thoughts, feelings, and behaviors are connected in order to then make a behavioral change. Okay. Wow,
this is some good stuff and some good learning at the same time. So now with these, are these typically one-on-one type therapy, or is it group therapy as well?
These are individual therapies. Group therapy is also very effective, but as of now, these current therapies that I do are individual. Okay.
Now then also, because sometimes people have a stigma when it comes to feeling like they need to get therapy and that sort of thing. Kind of what do you say or share with individuals on truly the benefits of therapy as opposed to what the stigma might be?
I say this all the time, that everybody needs someone else to talk to. And usually our friends and our family, they're fine to talk to about general things, clothes, shoes, relationships. However, if there's something really serious going on, you should speak to a professional and someone who is objective and warm, non-judgmental, and who can provide you with the skills necessary for you to have an improved life.
Okay. So now, and we like you mentioned the trauma, and sometimes the traumas might be a little bit more obvious, or you're aware of someone that's gone through something, and so, logically it tells you there's probably some trauma there, and maybe they need some help. What other types, or for people that may feel they've just gone through something, but they don't feel that it's trauma, or that, they can handle it, what can you say to that person to encourage them to move forward with therapy?
I would say that so many people are sort of just floating through life and not living up to their true potential. I meet a lot of wonderful women who are just stuck. They're stuck. They're like, I don't know what's going on. How do I reach my goals? I'm just here. I feel like I'm not a part of everything that's going on. Generally, when that happens, there is a trauma. There's something that happened in the past that they just stuffed down and figured they could push it away, but it doesn't go away. These things don't go away. You have to address them. They're not going to go away just with time or just with, history. You have to address them and get some help.
Right. Well, thank you. So now on the family side, so you mentioned working with families as well.
Yes.
What does that look like?
So working with families, gosh, that's such a big part of what we do. It's very important. Even if a child comes in, the mom says, okay, my child was suspended from school. He needs some help. I will talk to whoever's involved because the problem is not usually just one child. It's everything that's going on. The mother may be overworked and stressed out, and she may not have a support system. The father may work too much. And so we try to involve every single person in order for the child to get better. A lot of times parents are overwhelmed, and that's why the children are responding the way they are. Parents need support too.
I was about to say, because a lot of times we'll watch some of these shows where they're working with children, and what I always glean from that is most of the time they end up working really with the parents as opposed to directly the children themselves and really kind of teaching the parents how to work and interact with the children and uncover some things.
Absolutely.
Yeah, so what are some of the things that you might do with parents?
So parent-child interaction therapy is one treatment that we use, and generally that's also an empirically validated treatment, but at the beginning you just sort of observe and then you'll give input and sort of coach the parent into a different way of parenting, a different method. And so when you have families, especially families that have been disjointed or separated for a period of time, when they're rejoining and becoming a family again, it's very important that they have some sort of guidance or training.
Fantastic. So now, you mentioned, in talking about parenting, you're starting what's called the Parenting Hub, the program. Tell everyone about that program.
I'm so excited about the Parenting Hub. How it came about is I'm in court a lot, just sort of working with families in DFACs and different parts, I guess, of society, for lack of a better word. But what I found was that there are so many barriers for parents to get custody of their kids. And the longer children are away from their parents, the more trauma they sort of endure. Because being separated from your family in general is a trauma. And so I sat down and I thought about it, and I figured, how can standard of care then take this sort of special population and improve services and set the standard higher for these parents? And that's how the Parenting Hub came about.
Yeah, I love that. And now we want to make sure that you tell everyone how they can get in touch with you, and then also kind of tell them who should be the ones to get in touch with you.
Okay, so who should get in touch with us? Attorneys, family law attorneys, teachers, parents, anybody who feels like they can help somebody else. Just let us know and we'll get you there. But first you have to contact us. It's never a silly question. Just call and ask. That's the best way to find out if the person who you are thinking about really does need help. The best way to get in contact with us is by our website, www.standardofcarepsychological.com. And also you can reach us at 678-973-2491.
Great, thank you. And before we go, there's a thought that I just had. I want to make sure that I ask you for our audience is this expensive? Is this something that people do through their insurance? And then kind of how long do they typically work with you?
So it depends on the problem. One, it's not expensive. We take most types of insurance, all types of Medicaid, and Medicaid programs generally have no copay, so this can be free of cost to families. Most of our families pay nothing. And therapy can range, from about 8 weeks all the way up to 2 or 3 years, depending on what's going on. And therapy doesn't have to be something that goes on for that long span of time. You may deal with this problem, sort of take a break, and then come back and something else is going on. So it's a very flexible way of improving your quality of life.
Okay, great. I love it. And lastly, tell everyone what's next down the road for Standard of Care.
So down the road for Standard of Care is the Parenting Hub, which will be opening in May, and we're very, very excited about that. Just look for us all over the community.
Fantastic. Thank you so much for joining us.
My pleasure.
We appreciate it. And before we give everyone your website again.
www.standardofcarepsychological.com.
Fantastic. Thank you for joining us, Dr. RJ.
Sure.
Everyone, we want to make sure and encourage you to, pay attention to what's going on around you, to the experiences, especially that the youth are having, because it is such a challenging time these days. They have so many just things that are going on in the world that they have to deal with that we didn't necessarily have to deal with. It's a great opportunity to make sure that you reach out to Dr. RJ and share that, help everyone get the help that they need. It's not a bad thing. Like you mentioned, everyone needs to talk to someone. someone. So, she's skilled at this. She knows what she's doing to really help you along, or that child that you may know, or that family that you may know that needs some help. So definitely make sure that you reach out to Dr. RJ. I'm Pamela Alexander, your host of That's My Biz. And again, we want to remind you that you can check out our archives at www.bizlinks.tv. Also subscribe to our YouTube channel. Give us a thumbs up out there. If you have any questions or want to reach out to any of our guests, please feel free to share your comments, and we'll make sure that they get to them as well. Follow us on Facebook at facebook.com/BizLinksTV. Remember, with BizLinks TV Network, we want to expose your business to the world. Thank you for joining us. Today's show can be viewed on demand on our website at www.bizlinks.tv. If you are interested in having your products, services, or special cause showcased on our program, submit an inquiry to that'smybiz@bizlinks.tv. In addition, information on advertising and hosting your own show can be found on our website at bizlinks.tv.